We have 3 children. Our oldest child doesn't have any health conditions, but the younger 2 were born with quite a few health problems. They have problems with their eyes, slow growth, so they're quite small. They suffer with digestive issues and food allergies. They've both been tube fed as babies, as they have severe gastric reflux, which is controlled by medication. They also both have low core muscle tone and joint hypermobility, which causes joint pain and joint instability. They both had health problems from birth, but not all of the problems were apparent as soon as they were born. Whilst we know there's no guarantees that we'll get a diagnosis from the project, we feel like it's a good decision for the family because it's great that we can take part in a project that could make a difference to patients in the future. I feel like we're getting a best chance at a diagnosis one day for our children, which we hope will improve treatment options in the future. I think that many people would benefit, as doctors will learn a lot from the project and be able to use what is learned to provide more personalised medical treatment for patients. Any families or patients who have undiagnosed medical conditions could benefit from taking part, especially if, like for us, this is the only possible chance of getting a diagnosis at this time. I find it quite hard to not know what my children's condition is. It's in my nature to arm myself with as much knowledge as possible to make sure we get the best care and the best future for our children. But without a diagnosis, I feel that we can't prepare and learn what to expect for the future. I think getting a diagnosis for us as parents would mean that we can be better able to understand our children's health conditions and be able to find out what their future health could look like. Because, for example, if there are other people who have the same genetic condition as our children, we might be able to see what our children's health could progress like. And there might also be opportunities to access services that help and support children with health conditions, but they tend to be only available to people who have a diagnosis. So for us it's frustrating because not having a diagnosis means we're not able to access those services. I think that being part of the 100,000 Genomes Project provides the chance of receiving a diagnosis for our children, but also help shape the future of the NHS. I think the process of taking part was really easy for us as a family, and a lot of consideration was taken to make sure it was easy for us and a good time for us to attend the appointment. We were given a lot of information and had a lot of chances to ask questions, which made us as parents feel more comfortable.